first thing that you need to do is, you're either at home in front of a mirror, take your shirt or your blouse off, and you stand in front of the mirror. And the first thing that you want to do is just look at the mirror and look at both breasts. Now, newsflash, your two breasts are never exactly the same size. For reasons best known to the left breast, in 70% of women, the left breast is slightly larger. So don't just look in the mirror and think, why aren't they the same? That's absolutely normal, right? And the first thing that you then want to do is you want to put both hands above your head, just like that. Now, what should happen ideally is that both breasts should move up together. If for whichever reason you notice that one side is moving up and the other side is staying down, then that sometimes you may have a worrisome lump, and that might be an indication for you to come and get checked by a health professional. Now, still with your hands up, you want to turn to the side and just look in the mirror and see, is there any difference, are there any skin changes, is there any pulling in, and the same thing on the opposite side. Just because we're so used to looking at the front, we actually forget that there could be stuff going on both sides of your breasts. Now, that's the looking bit. Now, once you're done with the looking, we always say looking and moving. So that was a look, move, and feel. So after doing those particular movements, we've put our hands above our head. The next thing that you want to do is you want to put both hands on your hips and just press in ever so gently and forward. And what that does is you can feel these muscles tightening. So sometimes if you have a small little subtle lump that's maybe a little hidden, sometimes doing that can tend to make it a little more prominent. So if you do that and you see something popping up, that might be something that might require attention. The last component is the feeling. And so what we say is there's a couple of important tips around feeling the breast. Now, one of the things is traditionally we use the opposite hand to examine the opposite breast. And I'm going to use our little happy model here. She's called Jane. The trick to doing a breast exam is using the pads of your hand, the three. You use the pads, and what you do is you ever so gently just press down the breast tissue against the chest wall. The rationale behind that is that breast tissue is very compressible. It's like a sponge. So when you press down, it goes down. But if there is a lump, because it's a different consistency, then it stays up when everything else is going down. And that's why it's important to press it down. So what you're doing is you're just gently going round in a circular manner. You're pressing the breast tissue against the chest wall and trying to feel, ending with the nipple areola area, and trying to feel if there's any lump. And if there is a lump, it almost feels like a marble against your hand, and that's how you tell there might be something. Now, once you're done with the breast, again, you switch sides and do the same thing on the opposite side. But what we always say, the reason you open up the breast like that is the breast is tear-shaped. It's almost like a pear, so it goes all the way into the armpit area. And so it's important, even after the breast exam, to check under the arms for the gland. And so if there's a problem with the arm or with a problem with the breast, sometimes you may find that the glands under the arm are swollen. So it's important to check, because sometimes you may not even feel a lump in the breast, but you feel something under the arm and you're like, hey, when did that happen? Ideally, we say the best time to do that, if you're female and you're still getting your periods, is about a week after your period. And we do that because breast tissue is very hormone sensitive. So what happens is that, like, from mid-cycle to just before your period, the breast tissue is enlarging. And if you think about it, Dan, it's almost like having a cup, putting a sponge in it, and then adding water to the sponge. So the sponge is doing that, but the cup remains the same. And that's usually the most common cause of breast pain or discomfort, and that's why some people will say they feel a bit of discomfort and pain around their period. So that's really not a great time to do a self-breast exam. If you're not getting your periods, we say at least once a month. We used to be very pedantic about it and say once a month like clockwork. You need to do this, but we realized it was causing a lot more anxiety, and so we say every once in a while, once you have the tools, when you can remember, just try and do that as frequently as you can. If you're going to do it thoroughly, you'd probably need about 5 to 10 minutes. And again, we said this is just more for your awareness, but it's still important to get seen by a health professional.